So today I have a patient who has old acne scars of the face. He's got some rolling scars, which you can see under certain lighting. He also wants a general improvement in his skin texture. So the very first thing that I plan on doing is using Bellafill, which is FDA approved for those acne rolling scars. I'm going to perform a subcision, which means I actually undermine the skin, release the scar, and then once that skin is lifted, then I fill it with just a little bit of Bellafill. Bellafill is actually considered semi-permanent, meaning it lasts for about 5 years or more because of the way that it's made of collagen and this special thing called PMMA. After I finish the filler, then I'm going to go ahead and laser his entire face with the Pixel Erbium Pro laser, and that's a fractionated laser, and that's going to give him more of an even plane, also some skin tightening, and even out some of his color as well. Here I'm doing subcision, and you can see my needle going underneath and just breaking apart that scar tissue, so it's all nice and loose. Once it's loose, I go ahead and just put in a small amount of Bellafill right in the skin. You can see how it tense up, but it comes down smooth, and it helps really bring that skin back up from the scar. And I'm just going to keep doing that all around all these little areas that I've marked. It kind of looks like a reticulated giraffe, but once I get all those areas, then he's going to have a much smoother face. You can see the edge of my needle kind of just making little tunnels and releasing, and then the skin actually gets really nice and loose. And then all I have to do is just put a little layer of this Bellafill, and it just makes like a nice flat surface. So it's nice and smooth. And just keep moving across the face. Alright, so we just finished the subcision with Bellafill injections into the acne scars. Now we're going to resurface the skin and tighten it, give them a more polished surface. I'm going to use the Pixel Pro, which is an Erbium YAG laser with a wavelength of 2940. And what this does is this essentially creates these microscopic holes in the skin, which helps the skin produce more collagen, tighten, and it also evens out the top. So just so you guys can see how this works, this is a tongue depressor. And what I'm going to do is I'm going to actually pretend like I'm lasering the tongue depressor. Ignore the smoke. But if you look at that, it creates all these tiny, tiny, tiny holes which cover the entire face. And it essentially shaves down the surface of the skin. And as your body fills in each hole, it has to lay down more and more collagen. And then the holes also shrink as well, causing your skin to tighten even more on top of that. Alright, so we're all done. I'm just going to put a cooling gel on our patient here. If you take a look at his skin, you notice that he's got really, really even blended treatment spots all over his face. And the aftercare is actually pretty simple. The patient just has to stay out of the sun and put on Aquaphor or some similar moisturizer for the first few days. Because this is a fractionated laser, the holes are actually so small, and you're not actually removing the entire layer of skin, so that your skin still is well protected, and the skin heals much faster than the traditional techniques, which just burn off the entire top layer. So this is a fractionated laser, which is kind of like the newer and less with less downtime. Feeling okay?
Mm-hmm. Great.
Good. And you are all done.
Perfect. Thank you.
Yeah.